Today is Wednesday, May 27th, and this is our fourth meeting for our TASC Population Health Learning Collaborative focused on population health. Today our session is focused on community engagement, and we have Selena McCord, a program specialist from the National Rural Health Resource Center, to talk about community engagement. Selena joined the center in 2018 as a program specialist for the Delta Region program, the Delta Region Community Health Systems Development Program, with a wealth of experience in community outreach and education. So we are really excited to have Selena, a member of our team, as a member of our learning collaborative, subject matter expert, similar to when Rhonda and Tracy were our subject matter expert. So we'll do similar to the last couple times. We will have a shorter presentation from Selena and then open it up to discussion related to the homework assignment, as well as any other questions you guys have before the end in an hour. A few people might be trickling in as there was a SHIP webinar ending just as our meeting started. Star 2 will unmute your line, and please do dial into the audio portion of the webinar today so you can participate in the discussion. Selena, thank you for joining us. Are you there? You may have gotten remuted.
Hi, Caleb. I'm here.
There you are. Howdy. Well, welcome.
Thank you for having me. And I'll go ahead and get started. So as Caleb mentioned, I am Selena McCord. I'm a program specialist. I've been with the center. It'll be 2 years this coming June, and I work closely with the Delta communities and hospitals. We work with these hospitals to help them prepare for an infrastructure for population health, which is the central emphasis of this Learning Collaborative series. And so this includes ongoing communication with those hospitals to identify priorities. We work with their liaisons to strengthen the outcomes of these hospital and community partnerships in the Delta. So as Caleb just kind of mentioned, I have a lot of experience with community-focused work. I don't think I'm necessarily an expert just yet because I feel like there's always something more to learn in the field. So I'm excited to be here today to present to you, and most importantly, to hear what you guys are, what some of your hospitals and communities are doing, and some of the ways in which you can help expand and enhance their community engagement opportunities. I have designed today's presentation to provide insight into how the program that I work closely with, how we provide technical assistance for those rural hospitals, specifically around community engagement. And Caleb, were they supposed to take a survey or anything?
Sorry, I was on mute. It was loaded as everyone joined, so they hopefully got an opportunity to do that beforehand, so you should be good.
Okay, great. Just checking.
Thank you.
Of course, I want to recognize the center and the real experts here, and that we are a nonprofit organization, and we have been working with rural hospitals in their communities for over 20 years. And our 5 focus areas are listed here. So today we'll touch more closely around that collaboration and partnership. Of course, I want to start the presentation with revisiting the definition of population health. I know that Tracy shared this with you guys during the first learning collaborative, but it's also important just to take a second look at it again, as it is the central focus of the learning collaborative series. The concept of population health is basically around addressing those multiple health determinants, and for a group of individuals to improve the overall health of that group. Now, it gets tricky when you're talking about managing this concept. It could be multifaceted, and there is no one-and-done approach with population health. As I'm sure you've been able to understand with the work that you're doing in your hospitals and communities, and just how TASC has outlined this Learning Collaborative series, I find value in that they are focusing on different components of what helps to build an infrastructure of population health, because there's so many different components involved. To successfully, of course, address the health of a population involves data, and look at how a person's mental health impacts their physical health. Rhonda and Tracy both touched on these points. And what I would like to touch on is that part about engaging with the community to create that capacity and establish full ownership. So with that, and now that we're grounded as to why we're here, talking about a component of population health that creates capacity and establishes ownership in community is really community engagement. And the World Health Organization defines it as a process of developing relationships that enable stakeholders to work together to address health-related issues and promote well-being to achieve positive health impact. So in other terms, it seeks to include those users of these healthcare systems and community resources in all aspects of engagement. And those include designing, planning, and delivery of the healthcare services to achieve long-term impact. And not just impact of those things that could be measurable within the hospital, but the impact of and outcomes of the processes, the relationships that are developed, some of those soft measurable outcomes as well. Community engagement does ensure that health and social services are tailored appropriate to population health needs, and it is beneficial for the community in that it seeks to establish a process for incorporating community input. It ensures transparency and establishes trust. It helps to create resources and strengthen communication channels. It's most importantly inviting the community for their feedback, hearing their voices, hearing their opinions, because they are the expert end users. And it creates higher quality solutions. And most importantly, what stands out to me about the benefits of community engagement is that it empowers those residents to address community needs. Community engagement is a critical function of strong healthcare systems. And when we have worked with our Delta hospitals, this program has been started back in 2017. So we're in our third year for our first cohort. And so we've been able to hear from them and understand what type of benefits that they have witnessed as a result of working to build an infrastructure for population health and engaging with those end users, those key stakeholders, and those partners. And some of the benefits specifically for the hospital have been reported of better coordination of care, improved transitions of care, enhanced community awareness of those locally available resources, improved perception of the hospital, and the reduction of outmigration and bypassing of those local services. Right now, we are living in a pandemic. Folks are scared to come into the hospitals, and now more than ever, community engagement is critical. It's critical to be able to work with those stakeholders and just reinforcing that message that, hey, these are the steps that we're taking in the communities, in the hospitals, to make sure there's a safe place for you guys to come. Using those stakeholders to help you promote, the hospitals promote those services that are available. Right now, telehealth services are beginning to expand in some of our rural hospitals, and so working with communities are so important to share, hey, this hospital has this available services, here are how the operations are continuing, being that voice. With the Delta program, we focus on these critical steps for community engagement, and this is in no way am I saying that this is the only approach to how hospitals and communities could engage, but this is something that keeps our foundation as we are working at the start with most of our hospitals, beginning to help them see what engagement looks like and some of the critical steps that are important. And so these steps include understanding the needs, planning to collaborate, building that foundation, evaluating, and follow-up. Grounding efforts in the health of a total person is essential for population health and specifically for community engagement. So keeping in mind that not just a person's physical health is impacted, but also their mental and social health. Again, Rhonda did a great job by touching on what a total person, treating a total person is like. And so addressing those three main areas. As the industry continues to move towards population health, we recognize that wellness and prevention is the key to managing populations in the future. So with that, we know that only healthcare accounts for 20% of a person's health. And so what stands out from this particular graphic here is just reminding us about 40% of what contributes to an individual's health outcomes are those social and economic factors. For example, it could be unemployment, poor housing, food desert, or crime, for example. And these conditions and circumstances are often referred to as the social determinants of health. They are the circumstances in which people are born, work, grow, and live. Understanding the need is critical before you begin engaging with a community. With a lot of the tax-exempt and public-owned hospitals, there is growing expectation to address and understand those social determinants of health. And with community health needs assessment, these hospitals that are tax-exempt are typically required to complete these every 3 years with the input from their community stakeholders. Another source here that I have are what we refer to as community health status reports. It is a secondary data source that could be compiled for hospitals and communities. It's part of the TA that we provide to our Delta programs as another source of information as they are beginning to look into their communities and identify some of those health factors that impact health outcomes. And it's a snapshot of the community's county and state. It includes background about the hospital and the services the hospital provides, along with those social and economic factors and health behaviors that impact a person's health. A critical player in community engagement and how we approach it is finding or identifying a liaison, a trusted person that is in the community, that is looked at as a gatekeeper, or that knows all the secrets, that person that people feel comfortable going to and sharing some of their most sensitive information and the challenges they face when it comes to accessing services at the hospital or other health and social services providers. We refer to this individual as a community champion. You may refer to this individual in your hospitals and communities as a lay health worker, a community health worker, or a promotor. The interesting thing, well, the most important thing to note about this community liaison is that their roles and responsibilities vary widely, and it just really depends on the hospital and where they are with population health and community engagement, and it also depends on the comfort of that liaison as well. Our community champions are responsible for positioning their hospitals for population health, specifically building awareness of the hospital services, facilitating that engagement between their hospital and community joint partners, and supporting the development and implementation of community action plans or community engagement plans. Given the scarce resources in many of our rural communities, it's important to note that multi-sector collaboration is critical. It is key. While hospitals are oftentimes encouraged to leverage that central role, literature does suggest that community health improvement efforts are most successful when they are grounded in a collective impact and where there are highly structured collaborative efforts as well. Collective impact focuses on the cooperation and the collaboration and partnership to achieve those common priorities and to inform those partners of particular strategies to address community health needs. I love this graphic here. It's a perfect depiction of seeing the hospital among the partners, as you can see, and not regarded as the central player. The most important person that should be centered are the patients, are the residents, are the community folks. Community partners' level of influence and community engagement will vary and will depend upon those prioritized needs. So as a convener, hospitals must be intentional about the why for partners' involvement in collaborative efforts. So with that, messaging to potential partners should be carefully crafted. I love this quote by Simon Sinek. It says, people don't buy what you do, they buy why you do it. And what you do simply proves what you believe. So as a hospital is beginning to identify who they wish to engage, it's important to take a step back and look at, well, what are the challenges this particular potential partner may be facing? How does their why align with our why? And how do we plan to approach this potential partner to ensure their buy-in or to create their buy-in? So making sure that your messages are just not a one-size-fits-all, making sure that they are tailored to address their needs as well. So we've talked about identifying those potential partners and thinking about the messages that you structured to bring them to the table. But what happens once everyone is there? With designing meetings and workshops for participation, it is critical for community engagement. Technology of participation facilitation methods, also referred to as TOP, is grounded in this collaborative effort that draws human assets and harness people's energy and wisdom. TOP promotes inclusive participation and profound respect. And at the center, we design our workshops for participation by incorporating these TOP facilitation methods that you see here, such as a focused conversation, such as consensus-based workshops and action planning workshops. They all work hand in hand in increasing shared awareness, including a group to make a decision from objective information, thinking about some of those responses and being able to interpret the information that they hear as the hospital is presenting the needs of the community to them. The consensus workshop method more so focuses on, now that we know what we know, what can we do and how do we do it? And thinking about involving everybody to be able to create some decisions or ideas around decisions to do. So for a moment, I'd like to share how that is structured for community priority planning with the Delta program. Our hospitals and communities receive technical assistance through the center and for this program over a 3-year period. And the community priority planning is a first collaborating with stakeholders for population health. Some objectives for this workshop are community's future. So thinking about what is a healthy or health improved community look like for for our residents. Identify and action plan solutions to those communities' needs, and discuss and confirm commitment to collaborate. That last bullet point is very important because, as I mentioned, community partner involvement will vary, and it's important that you take the hospitals and community partnerships, they take time to evaluate or determine who is committed and for how long and what are you willing to commit to. So the way in which this is outlined is first we start with sharing the data, going back to understanding the need. And that data could be the hospital's community health, the hospital's CHNA, or a secondary data source such as a community health status report. And then taking time to identify what a victory looks like. As I mentioned, what does an improved community look like? What does a thriving community look like for our residents and our patients? Then breaking down into more of a workshop to have some consulting, identifying those barriers and strengths, collaborating to understand what can we do to reach our victory, what are the strengths that we type of activities will deal with the barriers that we have identified already and move us towards our victory. Again, our victory being a thriving community, a healthy community, a community that addresses health needs. And finally, action planning. What are the tasks and steps to make this priority a success? It's very critical to spend time action planning. A lot of times you might see a lot of these community engagement workshops and meetings take place. We come up with so many different great ideas, and we leave the meeting with nothing in hand, with no plan. And so while it's great to bring everybody together, it's defeating the purpose when everyone walks away with just their ideas. So taking time to action plan and saying who will do what is so very important to see community health improvement. Evaluation is also a critical step in community engagement, and not just looking at those health outcomes, but specifically taking a look at the collaboration within itself. We with the Delta program, we use the Wilder's inventory tool. It evaluates collaboration based on 22 research-tested success factors, and it's a quick 15-minute opportunity for everyone in the room to assess, well, how is our partnership? Are we moving in the right direction? What is missing from the partnership? It can be used for flex coordinators to forecast the challenges and tailor solutions for stronger engagement as well. Follow-up. Follow-up is very important. It gets back to the point of leading with a plan. But once you've left it with a plan, what's the next plan? We're always finding ways to plan with our hospitals and communities, making sure that the next step is clear to all the partners and stakeholders. So starting with just even sending a simple thank you email to those partners, that says a lot, because most of these partners, they don't have to be at the table. It's nice that they come. A lot of times these type of community engagement workshops or meetings, they do take some time out of the day. So just simply thanking them for their input, thanking them for being active participants, sharing the outcomes of a particular meeting or workshop, and outlining some of those next steps for implementation and confirming what happens next and beginning planning for the next meeting. So for just a few moments, I want to share some of the impacts and outcomes from community engagement with our hospitals. We have collaborated with these hospitals and their community partners to engage them in community activities focused around priority planning workshops. We have helped to facilitate town hall meetings, and some of our communities are hosting their own block parties, all in the effort to build that collaboration, reduce social isolation, and then finding ways to incorporate the voice of the community residents. And so this hospital that you see here is Delta Memorial Hospital and DePaul Health Center. They are located in Dumas, Arkansas. And so from the work that they have done with us and how we've helped them, they have seen impact in the hospital as far as an increased utilization of their wellness center, as well as improved patient appointment compliance. Now for the community, which makes me most excited, is the opportunity to develop a new program that targets chronic disease management. The second hospital is Iron County Medical Center, located in Pilot Knob, Missouri. Impacts and outcomes from their engagement has been witnessed in the hospital with increased employee morale. It's interesting that this is an impact, and some may say, well, what's the impact about this with community engagement? Well, having a more engaged hospital staff that are engaged in making some of these planning decisions with community joint partners, it gives them some ownership in the work that is being done in the community, and it helps them to approach the work that they're doing in the hospital with some pride as well. On the community side, they have been successful in formalizing a community coalition to address substance abuse. Natchitoches Regional Medical Center is located in Natchitoches, Louisiana, and the examples of impacts and outcomes in the hospital have been decreased ED visits and increased utilization of their rural health clinic for Medicaid patients. For the community, it's been increased access to health assessments and increased awareness of the hospital services. This community has found a unique way to basically meet the community where they are and going into the community to conduct these health assessments at the food pantry, and finding an opportunity to work with their faith-based organizations to share and promote their services. So what else? There are several things that I can continue to talk about, but I just want to outline some other things for you to share with your hospitals and to think about as you're assisting your hospitals. That structure and infrastructure are key to success with community engagement. Strong leadership is critical, and it's not a single leader. So it's not just the hospital, or it's not just one particular organization, but having leaders, individuals that will take a stand and say, I'll lead this, I will coordinate this particular activity. So it is important to have strong leaders. An early focus on public health provides a foundation for a future population health and community health improvement initiatives. We've talked a little bit about that when thinking about the start and understanding what makes up a total person and some of those health factors that impact those health outcomes. Another thing is partnerships will take time. And they also will differ depending on what is the current activity or program being focused on. And finally, remembering to extend grace. This is so important. Like I mentioned, a lot of these community stakeholders and partners, they have so many other things to do. They wear multiple hats. So it's important for all involved in the partnership to extend grace. I felt like I had to at least address maybe the elephant in the room. What about community engagement during a pandemic? And that's something that we're all working to figure out. But there are several different platforms that can be utilized to help with community engagement right now. There are different video conferencing platforms such as Zoom. You have WebEx, conference calls, maybe initiating those, and of course social media. And so I'll just say that to say community engagement should most importantly continue during a pandemic, and there are different ways that it can continue to happen. Finally, here are some additional resources as you are working with your states and your communities and hospitals to consider, to think about. Of course, the National Rural Health Resource Center, The Community Toolbox is another favorite of mine, and the Wilder Foundation is where you can find that Wilder inventory tool for collaboration. All right, well, I think I've done enough talking, and so I want to hear from you guys and, like I said, understand what you guys are doing in your states, and maybe we can get started with some of the the homework questions that were sent out ahead of time.
Great, thank you, Selena. Star 2 will unmute your lines if you have questions.
Hi, this is Natalie in Montana. I'll go ahead and make a comment. Can you hear me?
Hey, Natalie.
Natalie, yes.
Oh, hi. Okay. So we are in the midst of doing many community health needs assessments. A lot of our hospitals that we're currently working with are all due June 30. So one thing that we have now encountered is instead of being able to do the face-to-face discussions with those community groups and community partners, we are trying to do it via Zoom. And as I'm sure everyone's aware, just the reading of the body language and how do you interact and get people engaged online is very difficult. So I guess I was wondering if anyone else has been tackling this and what kind of opportunities they've seen as ways to, I mean, especially going through community health data. Some people are really excited about it. Some people aren't or don't. Maybe not be as savvy with numbers, and so it's kind of more, yeah, just give me the bottom line and then let's move on. So I guess that would be a place for me to get some feedback from you guys in terms of what ways you've maybe engaged community members in the digital realm.
Yeah, thank you, Natalie. Does anybody have any feedback, suggestions? We've been working on that at TASC as well, just trying to move, we moved a couple of our summits, the Flex Workshop, the reverse site visit is virtual, so we're working on trying to improve or increase engagement or at least maintain it to have good engagement in meetings. And the partners that we've worked with to help facilitate some of the meetings have some tips and tricks as far as, especially for Zoom, for the video conference or meetings. They had little like icebreaker introduction things. So having everyone around the table introduce themselves, unmute their line so they are used to it and engaged in that level. And then they had little a tip like show us something on your desk that's within arm's reach and tell us a little something about it. So, if you got a fidget toy or something like that on your desk, just to have something to engage the participants in. And that seems to help, but I'm interested to see what other thoughts others are having. Kyle says she feels they're getting greater participation through Zoom because more people can attend than in person.
And Caleb, I'd like to make a comment as well. We have not yet had the opportunity to engage with our hospitals and their communities as of yet, but we are working to retool our approach to prepare for that. But we have been working a lot with our community our community champions using Zoom. And so some of those things that Kayla mentioned, just finding ways to break the ice, to make more people comfortable using these virtual platforms, because a lot of people, they're not comfortable with technology to even begin with. And so you're talking about the fear of technology, the difference in how they're used to engaging during a CHNA process. So you're trying to overcome two things as well. So finding ways to make them feel comfortable to share their screen or share their, open up to where you can see their faces. That's so very important to keep that engagement strong when you are using these virtual platforms. So keep encouraging, keeping that in the back of your mind as well. For our hospitals and states, it's going to be very interesting to see how they respond to a platform like Zoom, because with the Delta communities, and I just say this strongly because I am based in Mobile, Alabama, we like to talk a lot. And so it takes away, you have to find ways to keep things structured as well. So just keeping those things in mind too. It is a lot to think about, but people do find once they start using Zoom, they do begin to get more comfortable, and some may even begin to prefer it as well. As Kyle has mentioned, I think he said that they're finding more participation because people are able to easily access these platforms.
Right. We have found that it takes longer to go through the steps, to go through a meeting than in person. So the digital or virtual summit that we facilitated a couple weeks ago, Terry Hill and I, it does take longer to go through introductions even than it does in person in face-to-face meetings. So that's something else to think about, just the length of going through, 30 people introducing themselves and sharing why they think this is important or whatever it is. It takes a fair amount of time. So really understanding your agenda and what things you need to go through really help to make the meetings go smoother, because you do lose a lot of time in the digital format that you wouldn't necessarily think you should.
Yeah.
Anybody else have any thoughts on virtual engagement, especially right now, specifically related to community engagement? I mean, most of you guys have experience meeting virtually with your hospitals via webinars and things like that, but I do think there's a difference when you're meeting virtually across different entities and disciplines, and depending on what you're doing with them as well.
Yeah.
And I think we have additional distractions and things right now. I'm thinking of that as my dog is dreaming in the background and barking a little bit. How did we find the homework assignment this week? Did it seem to be beneficial in helping think about the, population health, the learning collaborative action planning stuff, things that might be beneficial for you guys moving forward? Sarah also mentioned sending meeting materials as well as discussion points ahead of time helps participants feel prepared and engaged. I agree, Sarah, that's a really good point.
And Sarah, I see you also had a question. I'm sorry to switch the subject. I just want to address Sarah's question as well. She asked, is the community champion a hospital employee? So yes and no. It just really depends on. Sometimes the hospitals will give the champion role to a current employee, and then other times hospitals that will identify or contract with a person in the community. So the hospital leadership, whether they are a contracted person or if they are an employee of the hospital, they are responsible for supervising that community champion. Our center, through our program, we help with providing that champion with educational support and building their capacity to lead the role. Mary?
Go ahead.
No, you go ahead.
I was wondering if Kyle, are you able to dial into the audio portion, Kyle? I'd like to hear more about your wanting to discuss more about clean water and air as determinants of health. I agree. I think that's a good discussion point.
Yes, and I really like to hear from everybody and learning about more of how your FLEX programs are working to support community engagement as well. Did I lose you guys?
I can hear you.
Star 2 will unmute your phone.
Thank you. Yes, star 2.
How did you guys find the homework assignment?
This is Natalie. I think it's always good to kind of go back and review and think about how we work with communities and kind of encourage them to engage with their partners in this process. And I find that sometimes there's not necessarily hesitancy to engage with partners, but just, you know, sometimes you get the, oh, well, we've tried to work with them before, and, you know, so it's kind of incumbent on us to give them that gentle nudge to say, well, let's try again, or let's at least reach out to show that you're trying, kind of thing. And then I think, too, another thing that really can sometimes be a positive or a negative is just with turnover in different staffing areas. You know, a lot of times the hospital, you're not always working with the CEO. They might be turning over, or the staff member that you've been working with traditionally turns over, and then there's someone new, and kind of starting that process again. So I think it's a great way to kind of reintroduce that, how the importance of collaboration and networking with your community peers. But I think, too, especially in our really small areas, they kind of naturally do it. And so sometimes it's a matter of just kind of pointing that out and saying, look, you already have this going on. You're already partnering with them. You just may not necessarily call it by those words or that language. So I think that's another neat opportunity, too. Kind of answering your question, but kind of not.
No, you made great points. And what I'll add to that is that you're right. A lot of communities don't realize that they're already engaging, that they're already collaborating, they're already working to fix big or small issues that will make a great impact. And so they may not be familiar with some of these terms, and that's important to note as well when you're helping these hospitals. How do they define community engagement? Or maybe they say something different. Maybe it's, for our communities, we say community care coordination, or it may be civic engagement. A lot of it all means the same. And so just helping them to identify what they are already doing to help improve the health of their community. And I think that's a good approach as well. And then also going back to your point of they've tried to work with the communities before, but they've encountered some barriers. Okay, well, let's talk about those. What are some of the barriers? And now that we've identified some of the barriers to working with the community, let's talk about some solutions to those barriers. What can we do to address the barriers or overcome those obstacles so that we can work together?
Hey, this is Stephanie from North Carolina. Can you hear me?
Hi, Stephanie. Yes.
And
How are you guys doing?
Doing well. How are you?
Good. So one of the initiatives that we have going on here is a statewide community health worker program where we are providing structured training for community health workers, not a certification, but moving in that direction, because as we move to managed care in other environments, we would like community health workers to be reimbursed employees, and so usually you need a certification for that. So we are working in that direction, and we also have, I'm sure you guys might have heard it, NC Care 360, which is a statewide, we call it Healthy Opportunities, but some folks call it Social Determinants of Health platform, where we have community-based organizations in a system, and hospitals and other care providers can refer to housing and food banks and transportation and so forth, and there's a system that will document whether or not that individual reached that resource or whether that resource was at capacity and not taking referrals, and it closes the loop. Those are a few of the bigger initiatives that we are working on in North Carolina.
Wow. That's exciting to hear. And community health workers are widely known. Their value is so very important, and a lot of times you have to work to share, what type of things that they can do. So I'm excited to hear that you are working to develop their capacity. Previously to joining the center, I did a lot of community health worker training in the northern region, specifically to prepare those community health workers for disaster-affected outcomes, such as how chronic disease is exacerbated from like hurricanes or any type of natural or man-made disasters. And so it does take some time to show the value of the community health workers, but they are so very important for health improvement outcomes.
And then one other resource that we have is we get about $15 million a year to support primary care in rural and underserved communities, and critical access hospitals are eligible for that funding. And so we had one of our critical access hospitals do a population health initiative, and they implemented, I don't know if you've seen it, it's called the Daily Mile. It started over in Europe, and it's where you're integrating exercise at the point of children walking and exercising and moving for a mile every day, and it's built in part of the education curriculum, and it involves building, a walking trail or something like that around the school. And so for many rural communities, there's nowhere that's safe for folks to get out and walk, so this developed a nice place for folks in rural communities to get out and walk, and they've developed that in multiple schools, and they've seen their chronic health conditions for all of their populations improve because folks had access to a safe place to walk, and the kids were walking a mile every day while they're in school, and then they're encouraging their parents to get out and do it at night. So we're really proud of that that program, and hats off to the hospital for thinking outside the box.
Wow.
Yeah, that's really great.
That's pretty cool. And again, that type of, when you're thinking about community engagement, it's putting the work back into the community. A lot of times it's not inside of the hospital walls. And so thinking about how just that walking trail has empowered residents with them seeing other folks walking around that trail and thinking, okay, well, maybe it's time I get out and go and join them, or just they're taking pride in their health and others are seeing it. It can be contagious, and just thinking how that impacts the healthcare services and how everything is delivered.
Hi, this is
Natalie. Oh, go ahead.
Okay. Sorry, Natalie. Yeah, just real quick, this is Brian from Texas. When it comes to community engagement, a lot of times what helps me is kind of drawing off of past experience and sharing practices, often with community needs assessments and when you're getting to know people, their individual expressed needs, oftentimes drawing off of my past experience, whether it's in my current position or in a position that I held somewhere else in the past. I feel like everyone, can appreciate a good story, and especially if they know people that and it's, you do have to obviously consider that their needs are specific to, their community, and you have to, be culturally appropriate and relevant to their situation. But it does get a lot of the ball rolling as far as sharing ideas and, people saying, oh, well, we can do something similar, or, and like I said, if they already know somebody within the story that you're telling, and there's that mutual, connection there, there's, not only you're building trust, but they can reach out to that individual and say, oh, how did you, do this project? How did you implement this initiative? We have a similar situation, and, it just kind of, I feel like it's a good technique to start conversations.
Yeah. And the unique thing about these, with rural hospitals and communities, they have that niche. Everybody knows somebody, and they're continuously building relationships. They have those levels of trust there. They just have to find a way to maximize what they're already doing.
Hey, this is Stephanie Nance from North Carolina. I have one more example if you guys want to hear it.
Absolutely.
Absolutely.
So some of our hospitals towards the beach started, there are actually 3 of them now, and they were the first 3 and the only 3 hospitals in North Carolina that are dementia-friendly facilities. And so what they did is they started with training with their hospital staff, and then they went out into the community. And one of the hospitals is at Nags Head, so it's at the Outer Banks. It's a high tourist area. And they went out into the community and developed a Purple Seahorse program where they trained restaurant staff to how to be dementia-friendly establishments. And then you put a Purple Seahorse on your door so that if families come and they have a family member or friend that has dementia, they know that by going to that establishment, there are staff there that are trained and trained to help that individual and provide service to them. So that is a nice way for the hospital to engage the community in a different way, and that opens up additional doors for the future. So I thought that was a really cool model. And one of the hospitals have weekly community engagement meetings where the community comes into their facility and they do a tour, they do planning, etc. But they have that at a very frequent basis to kind of keep momentum going.
I like that a lot. I think that's really, really neat. Do you know what the education is for, because it should be different for a restaurant worker than it should be for a nurse's aide, but do you know how they went about identifying that curriculum?
I don't have the curriculum, but I can certainly ask. And it's similar to kind of the high-level training like mental health first aid, where you're not training someone to be, a therapist, but you're training someone on how to be self-aware and also how to kind of provide some first aid and understand what to do. So, but I can reach out
I
and ask what curriculum they used.
Yeah, I think that's really neat, or just some suggestions or something like that. I think it would be neat to understand that a little bit better, and then, if there's anything that could be shared, that'd be cool too, but I think it's really neat.
Yeah, we'll do it. Because by nature, critical access hospitals are in rural communities, and we know that rural communities are more likely to be older populations, so it could be a model that that a lot of folks could use.
Yeah, and if nothing else, it could be a great opportunity for simple, low-hanging fruit engagement. And sometimes I did notice in the chat box that there are, I'm sorry, who mentioned it? Kathy, I think, from Texas mentioned that the Texas hospitals sometimes have a hard time gaining traction with their hospitals, and during the coronavirus made it more difficult. But I think that would be a great example to share, as this shouldn't cost too much money, maybe a staff person's education time for a community education session, but you could do that relatively inexpensively, and it would be a great relationship builder and opportunity. I think that's really neat.
Mm-hmm. This is Trish from Texas. Can y'all hear me?
We can, Trish.
Yes.
Oh, great. Finally. Oh, good. No, always had trouble with this. I would have a question in regards to training the staff. Is it sort of an ongoing training that's available? Do they do it periodically, given like turnover, if staff are leaving? How do you steward that? How is that program stewarded in terms of keeping staff trained and trained staff on the site? I would also think this would be a great model for people with or children on the spectrum as well.
Yeah.
Yeah, absolutely. Absolutely. So one of the hospitals has done, I think it's a purple teddy bear program where they, and they so this particular hospital that's dementia friendly and is the one that engages the community on a week to week, they have a whole slew of community volunteers that come and sit with patients who have been diagnosed with dementia but are in the hospital for other reasons. And they have a kind of like an activity tray, so that they have volunteers that come in and spend time and sit and engage with the patient. So it's a pretty cool model. I'll get some more information on that, make sure I send it up to you guys.
Yeah, that'd be great. We can let me know if you are able to. You can put it in the Teams world to share it out to everyone there. If you have any issues with that, just let me know, and we can get it posted for everyone there. I'm interested to see how well the Teams works for something like this. I'll let Andy put up the polling questions so we make sure we get those. We did have a couple other things in the chat box. Montana, Jen said that they have a hospital convene mental health first aid training for community members and community stakeholders to learn from each other and develop a plan for their community. I think that's great. I've got an example here. It's not necessarily a hospital-led one, but my community, there's a group of community members focused on grieving support, so not necessarily end of life, but post end of life care. And both the hospital as well as one of the big outpatient clinics are engaged in those meetings. They're participating in those meetings and offering meeting space and other things like that. So those are a couple examples of topics that hospitals as well as clinics and other community members are interested in. Within mental health, it's important to include children's mental health and child abuse prevention services to address. I think that's a good point, Trish. I want to make sure we captured everything in the chat box. All right. Not seeing anything. Thank you, everyone, for taking the time and completing the polling questions. To your right, please do take a moment to complete those as they help us make sure we're bringing you good, relevant, informative education. Next meeting will be Wednesday, June 10th at 2 p.m. and our topic is finance. We will have Ralph Llewellyn from Bailey & Associates to discuss finance and all things related to finance and population health. I'm really excited for that because I think that is one of the major hurdles hospitals need to or feel they need to get over in providing population health is financial burdens, reimbursement, just the expense of it, changing your the way you do business as an organization, as an entity. That's a lot to put on a hospital, so I'm excited for that. So we should have homework again a week from today. We should be looking for that around the 3rd. Please let us know if you have any questions. Downloadable files are in the left there. Yeah, please reach out with any questions. Thank you, Selena. We really do appreciate our session on community engagement. I think it was great. Some really good examples. Thank you, everyone. Please do let us know if you have any questions.